Hello everyone, Dr. Kaylee Garrett Zimmerman here, pelvic floor physical therapist, owner and founder of Fem Empowerment and Advocacy Online Academy, creator of Core Upgrade, Leak No More, and also the Fem Empower Birth, and also the owner and founder of Down There Docs in Tampa Bay for pelvic floor physical therapy. I'm super excited for you all to be here. I really wanted to just talk a little bit about, I've been getting some incredible questions about how does the bladder work? And when we have something like urinary incontinence or urinary leakage, why exactly is that happening? So what's contributing to that? So the first thing that I want to talk about is just exactly that. What is the bladder? How does it work? Our bladder is obviously very close in the female body, in the anatomy of a female. We have it very close to our digestive system, our bowels, our rectum, and things like that. And so that's why I always tell clients we can't treat the bladder without discussing the bowels as well. You have to talk about bowel and bladder health both. So first and foremost, the location of that is important. Secondly, we have to understand kind of how the bladder functions. And ultimately, the bladder has two jobs. It fills up with urine and then it releases the waste, or it releases the urine. And it can hold up to 400 milliliters of liquid at one time. And that's why it's so important to discuss the difference of, are you feeling a sensation to go to the bathroom, or are you feeling an urge to actually go? So with that being said, when the bladder fills up with urine, it has little hair-like projections that are on the inside. If it fills up with pure water and things that are not dehydrating it, it just does its job. It fills up until it starts to get full, which stretches the bladder, which sends a signal to the brain. The brain sends a signal to the spinal cord, which then again tells us that we have that urge or that sensation to go pee. And that's a normal functioning bladder. There's obviously a whole complex area there. There's a whole lot of things we can talk about specifically. But just in a layman's terms, or an easy way to understand, ultimately we fill up with urine, then we get stretch of the muscle from being full. That's going to send a signal to the brain. The brain sends a signal to the spinal cord, which then sends a signal to the bladder to release the urine, or say I have to go to the bathroom. You go sit on the toilet, the muscle at the bottom of the bladder releases, and we're allowed to relax the pelvic floor and let go of the urine. That is a normal functioning bladder. But let's say that we are filling our bladder up with things like caffeine, or things like alcohol, or dairy, lots of sugars, lots of processed foods. Remember, there's a lot of different things that can be considered a bladder trigger, and I'll walk through those here in a second. But if we're filling our bladder up with all of those things that are dehydrating it, the cilia is going to get irritated, and it's going to get dehydrated, and it's going to send a premature signal to the brain saying, hey, I'm full. Even if it's not really, because it's dehydrated, it's going to want to kind of contract to get the liquid out of the bladder. So it's a lot about that processing. It's a lot about talking about how is the bladder sending signals to the brain, and how is the brain communicating with the spinal cord, and vice versa. How are they all communicating to each other? Are they communicating appropriately? Is there anything that we need to do with rewiring per se, or do we need to just talk about bladder triggers? And so going back into those, if you're drinking things like caffeine and tea and sparkling water, flavored water, lots of citric acids, lots of sugars, lots of chocolates, lots of dairies, lots of processed foods, all the amazing things, right? But if we're drinking all of that, the majority of the time that's actually going to sit in the bladder and irritate the bladder. And then the bladder is not going to want to function properly. It won't be able to hold the amount of liquid that it's supposed to be holding, and it will want to release it prematurely. And so it's super important to pay attention to what we're putting into our body and how that is also signaling, because it's important to recognize that when we are talking about how our bladder functions, it is a lot of the nervous system. It's a lot about how, and the things that we're putting in our body, and how our body is processing those things, and then what we are doing with it afterwards. So I like to tell people it's not just pelvic floor dysfunction. That's why Kegels don't always work. There are so many different areas and so many different things that we need to consider when we're dealing with things like urinary incontinence, or urinary frequency, or overactive bladder syndrome. When we're dealing with those, we have to look at the bladder triggers, the things we're putting into our body. We also have to look at the way that our nervous system is connecting to our body, the signals that the brain and the spinal cord are sending to the bladder. whether or not you can determine if you have a sensation, meaning I feel like I might have to pee, but you can kind of offset it or distract yourself, or do you have an exact, like an actual urge to go to the restroom and urinate? So being able to determine those different things is so incredibly important. And then we talk about pelvic floor. The pelvic floor has the part of relaxing to let the things come out, or to let the waste and the urine come out. Your bladder sits like this. It has a muscle here at the down. It's got that little pointy muscle, right? So the kidneys bring the urine down through the ureters, which goes into the bladder. The bladder has the detrusor muscle. Detrusor muscle, there's an internal sphincter. There's also the vaginal opening. And so thinking about if that vaginal opening is really, really tense, we're going to be holding urine up because we can't release it. But then again, vice versa, what if the internal sphincter, the one that's right there at the bladder, what if something's going on there? We have to rewire or retrain that. And I say rewire because it's just the easiest way to kind of conceptualize what it is that we're doing when we're doing pelvic floor training. We're teaching you what relax feels like. We're teaching you what contract feels like. We're teaching you what a full bladder should feel like. What's the difference between a sensation and what's the difference between an urge? It's just really important to understand all of those things. And so again, the pelvic floor muscles play a role in that because their job is to release or allow all of that urine to release. If we have a hypertonic pelvic floor or overactivity, then we're going to resist the bladder from letting all of the urine go. We can also have vice versa. If we have too much weakness, we won't be able to hold the urine in, but it's not always that case. There's a false perception that Kegels are the answer to everything when it has to do with urine, and that's just not true. So be really, really mindful of the processing when you're thinking about all of the activities of the bladder, where it fills up and then it releases, and then being able to do that properly has to do with all of those things that we just touched on. And so incontinence can occur because of too much activity of the bladder and the muscles, or not enough activity of the bladder and the muscles, because of bladder triggers, because of poor habits, just in case peeing, I have to pee every time I leave the house, things like that, like paying attention to habits that we're forming that are not healthy for our bladder. And again, the triggers and things that we're eating and drinking, but then also dehydration, also thinking about the nervous system and how that plays a role. Being really mindful of all of the factors. So when you're looking for a pelvic floor physical therapist, make sure they are addressing all of that and not just Kegels and not just your pelvic floor. Because you can live leak-free, you can have control over your bladder. It just takes time to figure out what is the root cause, and then from there, how do we treat it? So I hope that that was helpful to give you a little bit of an idea and an overview on an easy way to remember how the bladder works and how things can go wrong. If you have any questions, feel free to ask them below. And until next time, remember I do videos every Wednesday and Sunday, and I'm excited for you to subscribe and constantly listen.